And so pain that comes not only in the form of chronic pain, but certainly joint pain, migraines, neurology. There's lots of things that can be done, and not just medicine, that can help with some of these things. Depression, anxiety, I would say a lot of the patients that I see do struggle a little bit with emotional well-being. And so that is something that we spend the time to talk about and to really think about ways that we can help them refocus and reclaim their lives. Weight loss, so we are working on that and partner with our community partners with the YMCA and some other different things with population health that we can actually help to with people on their weight loss journey. And then thinking about things like irritable bowel and the migraines like I talked about. So the POWER program has been an exciting pilot that we started, I don't know, maybe 6 months ago. So Dr. Pasek and Janaea Schwartz and I, Dr. Joe Pasek and Janaea Schwartz and I got together to talk about how we can help people as they're preparing for an elective surgery to go into surgery under really with optimal nutrition but losing weight. When you go into surgery, trying to, a lot of times people will say, hey, you can't have that surgery because you need to lose weight. But people will go through crash diets and then they end up going through surgery malnourished. And then it affects their recovery. And so we really wanted to put our heads together and come up with a way that we could help people with these elective surgeries, that we could help them be in their optimal health going into surgery so it can help with recovery time. So we specifically focused on people that were having like a hernia repair or even gallbladder surgery. And we were able to really work with a lot of these patients that helped them change their diet. They've lost weight, they've gone to the YMCA, and then they've actually been able to go through their surgery and come out in a better way. Now, some of them haven't even needed to have surgery, which is kind of cool. Not really for Dr. Pasek, but they actually they have not had symptoms with gallbladders because they are now eating better and have lost a little weight. So then we started talking to a few of our orthopedic surgeons because joint replacement surgeries, as you know, are very common. And so there's also risk involved with joint replacement surgeries, and there's some people that just don't qualify or they're not really ideal surgical candidates because of their weight. And so we've been working with Dr. Burt Callahan and Dr. Chuck Meinke in Ripon. We worked with their team at the Ripon Wellness Center, and we've been able to develop a really great group visit schedule that patients get referred to. They get the exercise, they start working on functional capacity, and they are really doing the exercise and weight loss they need and losing weight in preparation for their joint replacement surgery. We probably have maybe, I'm trying to think of how many patients have gone through it, but maybe, I'm guessing 20 patients that have gone through it so far. So it's not a huge N yet, but people are actually having successful weight loss and they're doing really well. And so we're looking to continue with the pilot. Eventually we'd like to expand that and maybe even not be only for preoperative weight loss, but it is something that I think has some promise. I forgot to tell you what it stands for. So POWER, I think that this is really cool. Dr. Pasek came up with this, but preoperative weight loss, exercise, and risk reduction. So I thought she should be working it. So that was a pretty good name. Total living are the group visits I've been doing for years, and so these really fall into the same concept, but the series of group shared medical visits that are addressing lifestyle changes to help with chronic disease. So there's a series of 6. There's a cooking demo that's involved in that that's coming up in December. So that's a really fun Mediterranean diet focused cooking demo. And then talk a lot about sleep and physical activity and all the different things that we look at for the wheel. And then having a great employee focus. This is my goal. So I feel like if Integrative Health can actually serve our employee population, then we are doing a job well done. And so the goal is that we can get people to recognize we're there. So we don't have as many people here as I was hoping, but hopefully there are people that know that Integrative Health exists. But to know that this is something that your insurance actually covers pretty well. And so our goal is to really focus on social, emotional, spiritual well-being, which is what Integrative Health is. Okay, and so keep that in mind. And as you go through and listen to the girls, then we can hopefully you'll take advantage of this situation too. So I'm going to let Maggie come and talk about acupuncture.
Hi everyone, thanks for having me here. So I'm going to talk today about stress and what that looks like at work and how acupuncture and integrative medicine can be an effective tool for a lot of these ailments. So every year the American Psychological Association conducts a study about stress, and the most recent one showed that 65% 65% of Americans say work is a significant source of stress for a variety of reasons. And if you look at my next bullet point, in particular, workers who have experienced a recent organizational change are 4 times more likely to report physical symptoms of stress at work. Lastly, occupational stress costs U.S. employers an estimated $300 billion a year through absenteeism, illness, and productivity. And of course, technology is considered both a blessing and a curse because of all the advances we have in technology that creates more stress and more for us to do. And according to this, 43% report being constant checkers, always on their phones or computers. So let's talk a little bit about stress and what that looks like. So most of us know that when we're stressed out, we don't sleep or we get shoulder tension. But the truth is it can manifest in a variety of ways. Irritability or anger, fatigue, lack of motivation, depression, anxiety, any type of headache, stomach upset, muscle tension, teeth grinding, a tight feeling in the chest. Any one of those and more, stress just plays out in a variety of different ways for people. But as it happens, acupuncture is a really helpful tool for most, if not all, of those ailments. So a lot of how acupuncture works is considered a little bit mysterious, but I can tell you what we do know. And that's that when the needles go in, it helps release endorphins in the body, which make you feel good. A 2013 study determined that acupuncture causes your brain to release neuropeptides, which help relieve pain and stimulate the self-healing process of the body. So unlike something like medicine, acupuncture is just this really great tool that makes your body function better overall. It always improves blood flow, and it alters neurotransmitters to help stop autonomic response, which helps alleviate symptoms of nerve disorders. It affects the part of the brain that governs serotonin, so it helps you have a positive mood. Helps with stress, so, the nervous system, you have the fight or flight, the rest and relaxation. Acupuncture helps downshift you to the rest and relaxation part of your nervous system. So heart rate slows, blood pressure, and cortisol levels drop. And another great fact about acupuncture, it's really safe. Other than some discomfort around needles, it's non-invasive and it's really effective. So the World Health Organization has a great variety of diseases and disorders that acupuncture has been proven to be an effective treatment for. In every culture and in every medical tradition before ours, healing was accomplished by moving energy. And that's exactly what acupuncture is doing. You always want to move chi, and chi is another word for energy. So let's talk a little bit about the history of acupuncture, which is tricky because it's somewhere between 3,000 and 5,000 years old, depending on what text you're looking at. But what we know is that it came about kind of from war. So in the very early days of war, when they were using stones and arrows, and when the soldiers were pierced, they found that some of their symptoms elsewhere on the body kind of dissipated. So that kind of created many years of study and observation, and then they identified that not just areas locally improved, but elsewhere in the body, even the internal organs. And that, after a while, created this whole framework of acupuncture, a system of meridians and acupuncture points, which is what we use today. So not a whole lot has changed since they initially discovered this. So acupuncture is always based on this idea that there are patterns of energy flow, which we call chi, throughout the body that are essential to health. So when disruptions of this flow occur, then disease or pain are created. And acupuncture is this great tool to help tap into that flow and restore balance in the body. So it was first introduced in Europe in the 1700s, and it's only been in the US since the 1970s, which is kind of interesting. So today there are more than 5,000 medical acupuncturists, so that's a physician that has done additional training to practice acupuncture, and around 18,000 licensed acupuncturists, which is what I am. So this is just a picture of the basic, there's 14 major meridians of the body, this is all of them. Each one has a different amount of points on them. So closer look at the large intestine meridian. So there's 20 points altogether. The first point is on the index finger, and it goes all the way up beside the nose to large intestine 20. And what's interesting about this is, as an example, large intestine 20 I use quite frequently to treat like sinus congestion. However, large intestine 4, which is on the hand, that is equally as important as the one by the nose because it drains the whole channel. So with acupuncture, it's not just about sticking a whole bunch of needles right where you hurt. There's points everywhere that have different functions and are important. So what does a course of treatment look like for acupuncture? So the first visit is always the longest one. It takes about an hour, and that includes the treatment. And during this time, I talk to the patient quite a bit, ask questions not just about acute or chronic pain, but also sleep patterns, digestive disorders, stress, things like that. And a Chinese medical diagnosis also includes you look at the tongue and you feel the pulse. And after all that is done, then we get them on the table and they have their first treatment, and then the needles are typically retained for 20 to 30 minutes. So depending on how chronic the issue is will determine how many treatments you need. So with acupuncture, unfortunately, you can't just get one and feel better. Usually you have to go frequently for a period of time. For a chronic condition, it'd be something like 15 to 20 visits altogether. For an acute condition, it'd be somewhere between 3 and 5. So then once those 15 to 20 visits are completed, sometimes the patient feels great, they stop coming. Sometimes they choose to come periodically for like a tune-up because they know that they feel better with acupuncture. So that could be some patients, they want to come once a week for an extended period of time. Others come once a month, once every couple of months, or they just call us when they feel like they need something. So treatments are always tailored to the individual. What that means is if I have 20 patients that all have low back pain, each of those patients will have at least a slightly different treatment because I'm never just treating the low back pain, I'm treating underlying issues as well, which is why I discuss sleep and all those other issues. So acupuncture typically has lasting effects, but sometimes maintenance treatments are required. So the needles are itsy bitsy. So I feel like the number one reason people don't get acupuncture is just fear or discomfort around needles. And mine are really, really tiny. They're like the size of a whisker. And often you don't even feel them go in. They're sterile. We use them one time only, and then they go in the sharps container. I mean it varies, but it's maybe 20 to 30 needles per treatment. The needles are retained for 20 to 30 minutes. And so what's really nice about this is I have the patient positioned really comfortably on the massage table. There's pillows, we have heat lamps, essential oils, and soft music, dim lighting. So the whole experience is really lovely. And a lot of times, perhaps not that very first visit, but thereafter, people fall asleep and they're really comfortable and they look forward to coming. So if you're nervous about needles, don't, because it's really just not a big deal with acupuncture needles. The extent of the side effects include some bruising where the needle goes and some bleeding where the needles are drawn, and that's kind of the worst of it. In fact, most people kind of report really nice side effects, so even though their pain hasn't yet gone away, they tell me that they're sleeping better, their appetite is better, they have more energy, things like that, and that's just the body coming back into balance, which is how acupuncture is designed to work. So you can really get a look at how very tiny it is here. I think I can fit something like 20 of my needles into a regular medical needle, so there's really nothing to them. Okay, so insurance coverage. So I do bill insurance quite a bit. I think people are often surprised by how much it does cover. However, Medicare and Medicaid never cover acupuncture. Cisco and Cypress cover for chronic pain. So all of the employees that have Cisco insurance, any patient with a chronic pain diagnosis that is 6 months old or longer, they get 20 visits per calendar year, and they can just come and see me right away. It's really easy, and the employees that utilize it seem to really appreciate that too. United Healthcare, Dean, Cigna, and Network Health sometimes cover acupuncture. The VA is also another really good resource. Our veterans, for a variety of reasons, they have chronic pain and also issues with PTSD. They do really quite well with acupuncture, and they have to be approved, but then they get, the VA's typically pretty generous with their coverage. You should always check with your insurance policy on coverages and indications. So for those people whose insurance won't cover it, we do offer cash prices. So it's $75 a visit, and then you get a break if you buy more. So if you get 10, it's $600. And a newer service that we're really excited to offer is called community acupuncture, and that is just $35 a visit. So community acupuncture or group acupuncture, this is individualized acupuncture treatments that are performed in a group setting. We love this because it makes acupuncture more accessible to more people, and they can come more often, which typically with acupuncture, you've got to come frequently for a period of time to really get better. And because we have this, anybody who wants to can do that. So in this setting, we can accommodate up to 5. And so once everyone's situated and the needles are in, another benefit is they can stay for up to an hour. And when you get acupuncture, the needles trigger this relaxation in your body. So a lot of times when I have to pull the needles after that 20-minute mark, it's kind of like if someone wakes you up from a nap and you don't feel done yet. In this setting, people can stay for up to an hour, so they really can get into that deep state of relaxation. It's a very respectful, quiet environment. And with group acupuncture, there's the same indications and contraindications as private acupuncture. In this case, though, I choose points, like I was kind of trying to demonstrate with acupuncture, you don't have to put the needles right where the ailment is. So in this setting, I choose all points that are more distal, like knees down, elbows down, so nobody has to disrobe in this setting. The only requirement is I need to meet with the patient and have that first private visit so that I can establish a care plan and go from there. After that, everyone is eligible for the group acupuncture. Now, we offer it, there's 5 different slots during the week, so we try to make it so anybody who wants to can get into that. So this isn't our room, but ours is set up similarly. We don't have the exposed brick and big windows, but that's kind of what it looks like. We do have, they're actually phlebotomy chairs, and they recline, so they're pretty comfortable. So we've been talking about acupuncture. Acupressure is another tool that uses the very same points, but rather than stimulate them with a needle, you can use your own hands, which means that you can take it anywhere. So acupressure actually predates acupuncture. So you use the fingers to gently but firmly stimulate acupuncture points. So it's good for a variety of things. It releases muscle tension, promotes circulation of blood and qi. And I'm showing you this because this is something you can take home, you can do it in your car or your office, and feel a lot better. Can be practiced anytime or anywhere. So really, if you wanted to, you could look up acupressure for pretty much any ailment, and you could probably find a protocol. But some of the issues people use it for are headaches, sinus pressure, neck and shoulder tension, muscle aches, fatigue, anxiety, menstrual cramps, and more. Okay, so the very first point is called Mintong. So this point is used for anxiety, agitation, insomnia. It also helps with the sinuses and frontal headaches. So what I want you to do is find the point. It's located right between the eyebrows, where the bridge of the nose meets the forehead. And with this one, you don't really need to apply much pressure because there's not much there. So what you do is you kind of do gentle circles for just a few seconds, maybe 3 to 5. And that will activate the point. So this whole series I'm going to show you takes just a couple of minutes. And after it, most stress-related ailments will be resolved by 1 or more of these points. I'll show you a picture of this one. So the Chinese name means Hall of Impression. Do you have everybody find it? You wanted to find it? Okay, gallbladder 20. This next point is kind of the headache point. So Chinese medicine is really cool because there's, a long list of different types of headaches depending on where it occurs on the body. So with Western medicine, you got a tension headache, you got a migraine, and just a handful. With Chinese medicine, there's this huge list, and you can tailor your treatment exactly for that brand of headache. However, the headache point is called gallbladder 20. So to find this one, you kind of feel along the base of the skull, Yeah, once you find it, it feels good to press it. And for this one, you can really sink in there more, and you can press it for a few seconds until you'll start to feel when things relieve for you. So like I said, any type of headache, any type of pain or stiffness of the neck, blurred vision, and even common cold symptoms, this point is used for. Any type of acupuncture, acupressure, if you take deep breaths from your belly, you're going to have a better response with it. So when you're doing this, make sure you're not wound up tight and just pressing points. You want to try to relax along with it so you have a better response. So that's really cool. Okay, gallbladder 21. So this is kind of at the spot where everybody has tension. So it's at the top of the shoulder. If you find the shoulder joint in the spine and you palpate along the upper traps, you'll find a spot that's more painful to press. And this might be helpful too. That's right where it is. So it's not right at the top of the shoulder. You kind of go back a little bit. Yeah. Yeah, somebody found it over there. So there's a handful of points in Chinese medicine that are considered forbidden pregnancy points. And it's because they have a down-bearing action on the body. This is one of them. So with pregnancy, you just press more lightly or avoid it altogether. So this point is used for, again, neck and shoulder pain or stiffness, irritability, poor circulation, and quite clearly, it's just right on a muscle that gets wound up tight pretty easily. So with this one, you find it with the opposite hand. And what I also like to do is rotate my neck. Once you find it, if you rotate your neck, you'll find that you sink in a little bit deeper. And make sure you relax and breathe deeply. So that one's called shoulder well. Large intestine 4. Okay, so this is the one, I feel like I meet a lot of people who have read about this point on the internet somewhere. It's kind of a common one. So this is located between the thumb and the first finger. And if you put them together, you'll find that there's a little mound that pops up on your hand. And if you press straight down into that mound, and it's going to kind of hurt if you're at the right spot. That looks right. It should be quite tender if you find it. So this point is really cool because it's good for pain anywhere in the body. And also in Chinese medicine, we call this the command point of the face. So any issue on the face, whether it's a toothache, jaw tension, a frontal headache, sinus congestion, that point is really beneficial for. It's another forbidden pregnancy point. And it helps boost energy levels too. So once you find the point with the opposite hand, you press, you don't want to bring tears to your eyes, but you want to feel it. And just rub it for a couple minutes and relax and breathe deeply. And so that's large intestine 4, if the picture helps anybody find it. Okay, our last point is called liver 3. So this one is actually on top of the foot. So ideally, you would do it with your shoes off, but that's not mandatory. So one way to do it is to take your opposite foot. So it's located between the first and second toes, kind of in the webbing there. You can press it with the heel of your opposite foot to kind of dig into the point. If you want more precise pressure, then of course you take off your shoe, and that's where it is. So I use this point on almost every single patient because, again, it's good for pain anywhere in the body. Also, the liver in Chinese medicine is kind of in charge of the emotions and the smooth flow of emotions in the body. And so liver 3 is known to kind of just, any sort of emotional upset, it kind of drains it. So emotionally, you feel a lot better, and of course, it helps pain too. So insomnia, emotional stress, clears the head and eyes, and it can help dizziness too. So of course, with this one, you want to make sure that you're breathing deeply. So, this is a picture again. Great search. So all 5 of those points can be done easily within a minute or two. And I think it would really shift you from kind of being in a stressy place to feeling calm and better able to cope during your day. So I'm going to end with a quote. So this is by the personal physician to President Nixon. I'm convinced that acupuncture is going to be one of the greatest contributions that any group of people has made to the future of all medicine if it is handled correctly by the people of the Western world. That's it.
So good morning. So I'm the newest member of the Integrative Health team. I've been with Magnesium for about 4 months, and I can tell you I am truly honored to be working with these ladies over here. Love coming to work every day, love meeting all of you. I don't know if any of you have come to me yet, but a lot of the Magnesium employees have been in, and it's been great to get to know them. So I am going to start with a quote as well. Hippocrates, the father of all medicine, said that the way to health is to have an aromatic bath and a scented massage every day. I'm on board for that. I don't know about you. A little bit of history of massage therapy, like acupuncture. It goes way back thousands of years, but there's writings that refer to massage therapy from China, Japan, India, the Arabic nations, Egypt, Greece. Hippocrates, again, he defined medicine as the art of rubbing, in Rome. In the 1850s, 2 American physicians who were studying in Sweden introduced massage therapy in the United States, where it became very popular and was promoted for a variety of health reasons. Something I don't think we talk about often enough, but is very powerful, is touch, the power of touch. Just in and of itself, a gentle touch can reduce your heart rate, lower your blood pressure and your cortisol levels, stimulates the release of endorphins that are the body's natural painkillers. And a 60-minute massage, studies have shown, has the same impact on your body as 7 to 8 hours of sleep. So if you're not getting enough sleep, come see me for an hour. 2010 study published in the Journal of Alternative and Complementary Medicine wrote that 45-minute massage increases the number of lymphocytes that boost your immunity and lowers the levels of cytokines that can reduce inflammation in the body. Now, under the umbrella of massage therapy, there are countless modalities. I'm just going to hit on some of the ones that I offer over at the clinic. So one of the most common questions I get is, what is the difference between a Swedish or a deep tissue massage? Swedish is just basically more of your relaxation massage. I use a lighter pressure, gliding strokes, and the primary goal of this kind of a treatment is mostly just for stress reduction, relaxation. Deep tissue is more the one everybody asks for. Some people think, it's okay. There's like this idea that deeper is better, and that's not always the case. But there's a mentality out there that everybody wants deep tissue massage. We go deeper pressure into the tissue structures of the muscle and the fascia. And it's more the primary goal of this kind of massage is for injury, chronic pain, that kind of thing. I also do reflexology. Zone therapy is another word for it, but it's just the application of certain pressures. It's done on the hands, the feet, and in the ears. In fact, this time of year, if you come on my table, I'll be pulling on your ears because it's thought to boost the immune system, so I'm pulling on everybody's ears these days. It's generally relaxing, effective way to alleviate stress as well. The theory behind reflexology is that these specific areas on the feet, hands, and ears correspond to different organs and systems in the body, and that the appropriate pressure of these areas can benefit your personal health. We also offer prenatal massage, and we've got this really slick pillow that has an open opening for the belly and the breast, and so you don't have to lay on these areas, which is kind of uncomfortable to lay on when you're pregnant, even when you're not pregnant. And so the mother loves it because she can lay on her belly for the first time in a long time when she's in my room. But massage therapy during pregnancy is a very complimentary choice for prenatal care. All the discomforts that can come along with pregnancy, like edema, anxiety, depression, muscle aches, joint pains, and it also has been proven to improve labor outcomes in newborn health. Here's my little mama, and some of the things that can come, to the forefront with pregnancy, from muscle pains, headaches, thoracic outlet syndrome, plantar fasciitis, leg pain. All of those things can be addressed with prenatal massage. I also do sports massage. I learned a lot about this before coming to Agnesian. I worked at Equinox Fitness in downtown Chicago and worked on a lot of athletes. And so we have people who come in from professional athletes, to even just your weekend joggers. Sports massage is a lot about stretching. It can vary for the specific athlete, whatever your sport is, the massage is different. It focuses on areas of the body that are usually overused, stressed from repetitive motion or aggressive movement. And the question we always get is, what is cupping? Here's Michael Phelps. It was brought to attention during the Olympics when he had all these purple circle marks all over his body, and everybody was, what is that? What is that all about? What does it do? We do cupping at Integrative Health. We do a lot of cupping, actually, with very dramatic results. Cupping can bring relaxation. The suction provides a negative pressure on the muscles and the fascia. So like a lot of times when we massage, we're stretching this way. The cupping actually makes us stretch up. The contrast to the positive pressure of a deep tissue massage is a very actually soothing, relaxing experience. Cupping promotes blood circulation, which will speed up your muscle recovery. The negative pressure from the suction allows stagnant blood and lymph to the area of tissue with several benefits. So when you see that blood, it's not a bruise. If I would poke on it, it doesn't feel like a bruise. It's just stagnant blood that comes to the surface. Once it's at the surface, your body can more efficiently eliminate it. So more benefits to cupping: relief from physical and emotional tension. It begins the healing and regeneration process. The exchange of blood allows the removal of toxins and dead cells. It enhances your circulation, warms the skin, softens tissue to regain elasticity, and can reduce inflammation. Trigger point therapy is something I use a lot with deep tissue massage, and that specifically addresses your knots, which we refer to as trigger points. What the science behind it is, we put ischemic pressure into the knot, and by doing that, we're cutting off the blood flow. That decreases the metabolism of the knot. That compression of the nodule, it prevents the muscle from getting calcium, and the muscle needs calcium to maintain the contraction. So when we put that pressure on, we cause the trigger point to stop spasming. Once the trigger point is released, we stretch it to its full length to tell the muscle its new length again. And then we use heat on top of it to increase the circulation to the area to prevent that knot from reactivating. This is something I do a lot of, lymphatic drainage massage. And lymphatic drainage massage is good for a variety of different things. Fibromyalgia, it's great for that. But mostly like edema, lymphedema, any kind of edema in the extremities. I have patients that come every week just to, and I truly see these kinds of results. They can come in with that before picture, and we do lymphatic drainage, maybe 30 minutes on their feet, and they leave with that after picture. And it's just a very light pressure, gentle strokes, and it increases the flow of the lymph where it becomes stagnant. And that's about 45 minutes of therapy in those slides. And that's pretty much an overview of what I do over at Integrative Health. Thank you.
So I don't know about you guys, but I was doing those points and I'm like, oh, holy cow, some of those are really effective. So Maggie talked me into doing acupuncture because I was a little bit hesitant myself because of the needles. And they go in your ear, which is a little weird, right? But it actually works. It really works. As long as you can let yourself relax. And it takes a while to let yourself relax. I can see where the benefit of going multiple times would be really important. And then we even tried a few little community things. So Amy, I don't know if you want to share your experience, but yeah.
We were talking about incorporating acupuncture into community services. So then it was for the first time in a long time. I did not have racing thoughts. I was actually able to be present and just, even after we left, it was just a very positive experience.
So it's pretty cool. The community, I find that people really like because it's like a yoga class. So when you have more than one person getting the same benefit, you actually all get extra benefit, right? So it's really cool. And I haven't had a chance to get in with Kelly yet because she's so busy I can't even get in because she has a very, very good reputation. She's really, really good. So anyway, so we have some future goals, and so this is, we're always looking to try to incorporate new programming as well. We do such a great job through the Health Resource Center doing a lot of education when it comes to wellness and when it comes to nutrition and cooking demos and all of these fun things. And so really keeping that going is a goal. And then Sarah is here, so I don't know if she's willing to talk a little bit, but I have learned more about art therapy. So art therapy is they're master's level trained therapists, and they can actually use art in order to help with healing. So I don't know if you would like to talk a little bit, or is that putting you under the pressure?
Well, I mean, we are very excited that it's going to be an option at Integrative Health because I think just for those basic dimensions of wellness, we would fit perfectly. And it's, again, using art, but we're also, I mean, it's like going to therapy, but we use art as an additional medium instead of just talk therapy. So it stimulates the other side of your brain. A lot of times people have emotions or feelings that you can't, it's hard to put into words. So it gives them that other opportunity to address some of the areas that you already talked about in here. So, and we do have things going on already,
right,
for both employees and the community. So,
yeah,
it's out there.
Has anybody done a de-stress lunch hour? Great, yes. So those are going to continue, and then we're hoping to incorporate a few more fun things into that. I'm hoping to call it Project Flourish, but really get in maybe some resiliency writing activities, maybe doing some different signature strength type activities, and trying to really help people learn how to use really resiliency intervention tools that have been studied that can help to improve our own the ability to bounce back. And so that's one thing. I would love to expand the POWER program, so this is something that we're hopefully looking to do soon. We're limited a little bit just based on our dietitian's availability, so we're working on that. And then trying to do even more cooking demonstrations. So that is something that, again, is my future goal. It's been something that's been popular in the past, and so hopefully we can get back there once we have a little bit more staffing. So anyway, so that's all we have. We have a little bit of time for questions. So does anybody have any questions? Yes.
Well, the introduction of the art therapy thing, is that something that will be looked at as being covered under insurance?
So we're working on that. So right now we're thinking of offering it more in a community class type of a way, like trying to do cash payment at an affordable price. And so there was a survey that went out a while back. I think maybe some of you were able to do that, looking at doing a four or two?
Right now I think this is 2.
Okay, a 2-week series that to try to help with healing through art therapy, and ask what hour would work best of the day, what price would work best, because we want to help people really know how this is available and that it can be affordable too. And so that is starting in December, and there's actually a program going on now too, right?
I think the December one is
just for employees, yes.
And then we're looking at January, coming out with a more community-wide opportunity.
Yes, and we want to be able to do this in a way that, that we have a curriculum so that people can say, hey, I'm interested in doing this particular one, but knowing that the more people come, the more they'll benefit. So what I've learned about this type of therapy is that it really helps to process emotion in your brain, things that have maybe been there for a while and it's pervasive in your thoughts, but you try to just kind of keep them on the shelf, you don't ever really want to deal with it. It helps to work through it in a different way so that you can then process it as a memory and start to heal. And so I love this idea, and I think that with the more opportunities we have available for this at an affordable way. Now, it is a therapy, so there are ways to bill insurance. Currently, it's done on an inpatient setting. They don't do it as an outpatient. We're working on trying to figure out a way to offer that as well.
So we do currently see patients, we don't have it on an outpatient basis right now. But I think our goal and hope is that we continue to offer these classes and the interest is there, enough that we can promote that being an individual option at Integrative Health. And I think that is our hope.
That's the goal. It would be that there's a lot of kind of red tape involved with that, so we just have to figure out how to do that so that we can bill insurance. But the goal would be that, yes, we could refer patients specifically to see Sarah or one of her colleagues for an art therapy session.
Sorry to keep bothering you.
No, that's great. Yeah.
Do you notice if you have, has it been open to the community before or not?
There have been some classes through Health Resource Center, and so there have been people that have really enjoyed it and benefited. She has some really impressive slides. We should have had you show those on the de-stress lunch hour about how people doing a stress test kind of, before they come in and then afterwards as to how they've seen an improvement in their stress level.
Have you noticed the youth using it at all during the community? Well, a lot of the information that we have is currently what we're working on has been here at the hospital for the de-stress lunch, and that's for employees. Yeah. But it is definitely something that youth, because I'm asking for my daughter.
Sure. I have actually referred a couple of my patients' mother-daughter teams to the most recent community program that was started on the 6th and the second one's on the 13th. So just as a way to do that, I know that through Health Resource Center, was it last spring? That you did the Between You and Me presentation? Yeah. And so they were here and that we were able to work through some things, some different stations with their daughters. I thought it was really cool. My daughters, I think, thought it was cool. She's 12, so you never know. But I don't know how you were there too.
No, my 12-year-old did think it was cool for sure, and it was probably the best part of it. The programming was great, but just that time was really one-on-one. It's all about art and talking together. So that's absolutely great.
Yeah. It was neat. And my daughter has continued with those memory students actually. So yeah.
I'm just curious. I see acupuncture is covered by some insurances for chronic pain. Can you explain to me, with what you've heard about why massage therapy would not be necessarily covered for chronic pain?
Yeah.
No, I agree. I mean, I'm like wishful, hopeful. We're not there yet.
Yeah. It's just also why would Medicare and Medicaid not cover it, right? And in the world of the opioid epidemic, to me, it makes the most sense that insurance would start to cover things like this that are actually really great at treating chronic pain, but also not nearly, they're addictive in a good way, right? Like they're something that we could do for people that could be really helpful. So honestly, I don't know why they don't. I think that actually at a policy level, being able to work to get Medicare and Medicaid to cover those type of services would be ideal, so then other insurance would cover, would follow. But some of our local plans cover acupuncture really well. So the VA, she talked about the VA administration, their insurance, but also UHC that Mercury has, they cover really well. Network Health that state employees, right? They cover really well. There's charter insurance they have at Anthem Blue Cross Blue Shield. They cover like up to 30 treatments a year. It's like $11 copay or something. And so there are more and more insurances. I'm actually starting conversations with the health plan to make sure that we can continue to that they are covered as well. So I'm working on that. So yes.
So these nutritional health centers are popping up and they're doing blood testing to try to figure out food intolerances. And is there any medical validity to that?
Not that I know of.
Okay.
There are certainly people that have food intolerances, right? There's celiac and then it's non-celiac gluten intolerance is recognized. As far as I know, I don't know that there's any evidence supporting it. However, that being said, I've had a few patients that have gone through it and they are doing really well. Now, I think some of that is just that they're being much more engaged and they're really paying attention. It's very, very expensive and insurance does not cover it. And so I don't know.
A friend of mine is going, it's $3,000.
Yeah, I mean, and then that's the initial, right? And then there's maintenance after that. So yeah, so it's very expensive. Yes.
Are you using acupuncture for rheumatoid arthritis at all and finding relief for those? Yes. Yep. Any type of pain. And acupuncture, of course, doesn't work for everyone, and so you don't really know until you try it a few times. But I have people who come regularly for their arthritis and a whole variety of chronic pain conditions. I couldn't tell you for sure, but I certainly have seen that before, and it's been successful.
And cupping, if you haven't tried cupping, I think I've referred a lot of patients for cupping because it's really fairly quick. It's like 15 minutes. It's really efficient, and I tried it, and it doesn't feel great right away because you're like, you have all these suction cups on your back. But it does relax over time, and it really is, I think, for me, was incredibly effective at the tension. And it's not very expensive. It's $25